For someone who has been paralyzed, simple daily functions are difficult. But now, there is realistic hope for meaningful recovery in the field of paralysis treatment, even many years after the injury. Located in the heart of Johns Hopkins Medicine campus at the Kennedy Krieger Institute, a new story begins for people with spinal cord injury and disorders of paralysis.
There is no system in the world that deals with people living with paralysis. The majority of the medical system only focuses on that acute event and the first few months afterwards, called rehabilitation. And once you're done with that, that's it. What we've discovered is that if we work hard with individuals, we can do things by activating the nervous system that help support regeneration of the nervous system and can allow recovery in most individuals, even long after the injury, many, many years.
The Kennedy Krieger Institute, we use a lot of interventions which are familiar to therapists and then some which are brand new. We also use equipment that's not brand new, but we use it in new ways.
Advanced restoration therapies include methods such as functional electrical stimulation to help individuals with paralysis activate paralyzed muscles and optimize spontaneous recovery of function. An individual living with paralysis can now simulate the physical activity that a person normally experiences in an average day. Riding an FES bicycle for 1 hour is the equivalent to walking 6,000 steps. Activity and stress on the bone is important to offset the accelerated aging, osteoporosis, and bone wasting which normally occurs following immobility. The FES bicycle produces a pattern of normal activation in the nervous system. That activity can stimulate cells to be born, cells to migrate to the right places, broken connections to regrow, and cells to re-insulate damaged connections and restore function in circuits that cross the lesion. The goal of the activity-based restorative program is stimulation of spontaneous regeneration and recovery, such as remyelination of those existing connections across the lesion. Activity also stimulates axonal regrowth across the chronic scar by stimulating broken regrowing nerve endings to release metalloprotease, which creates a tunnel zone free of inhibitors, allowing axons to cross the chronic injury barrier. The goals of activity-based restoration therapy are to normalize the pattern of neural activity below the injury level to optimize spontaneous regeneration while achieving the known benefits of exercise.
They can get their cardiovascular function back. They can rebuild their muscles in the paralyzed limbs that they did before. Rebuilding those things can offset the advanced aging that occurs with a devastating injury to the nervous system that causes immobility.
A former patient of mine once said that patients had the duty to meet the scientist halfway. Maintain their body in order to be able to be good recipients for when the cure comes or the final answer comes. So if nothing else, that halfway is being met here.
The center treats individuals with paralysis across the continuum, from pediatrics to adults. Supported by an affiliation with Johns Hopkins Medicine, patients know they get the best treatment possible and the most exceptional health care.
The relationship between Johns Hopkins and Kennedy Krieger is really very close historically up to the present day.
Well, the advantage of doing the research here at Kennedy Krieger and Johns Hopkins is that there's a very strong neuroscience community here at Johns Hopkins University, and we profit from that. One of the main problems after spinal cord injury is that there is a progression of tissue loss and cell death. And we can limit that. We cannot completely stop it, but we can limit that by administering molecules soon after injury.
The strengths of the center are threefold: research, clinical trials, and clinical treatment. Research is critical to have hand in hand with clinical treatment, as information needs to feed freely back and forth between groups and efforts in order to optimize clinical care and treatment. Our clinical trials data demonstrate that 100% of people undergoing ABRT will have benefits in terms of physical integrity of the body and in offsetting the multi-year loss of function typically seen after major nervous system injuries.
But we offer a meaningful recovery of function to most individuals. What we find is that 70% of individuals get substantial recovery of function in a number of months.
However, advancing science and developing new technologies are not enough. The center provides compassionate care through the best and most highly trained therapists and physicians. It is the only center in the world dedicated to optimizing recovery of function via activity-based restoration therapies in individuals living with paralysis.
I began working with Christopher Reeve. I knew that we could help him by helping reduce the medical complications that he was incurring. He had the worst level of spinal cord injury, C2 level. We knew that if we offered him exercise, that we could overcome this. So we started to do that, and he responded to that. Then within a year, he started to recover function, first a finger. Then in the end, he was cycling on a bicycle under his own brain power. So we recovered nearly 20% of his motor function, 70% of his sensory function, a remarkable degree of function. And that was one of the key pieces of evidence that really led us in this direction to develop this restorative therapies.
There are endless possibilities, and as a physical therapist, I feel that every day I'm challenged to learn more and to know more. My patients ask me to know more. My patients want me to know more, and they challenge me to explore new technologies, to explore new therapies, and to offer them things that they are not able to get anywhere else.
We all collaborate really well together. It's not just you. You know, you're constantly talking with other therapists, working very closely with occupational therapists and the doctors, which is, in my personal experience with physical therapy, I have not had that. So that's really nice as well.
Our staff are the highest trained and level staff in the world. The ratios are 1-to-1 therapist to patient. They've been specially trained in activity-based restoration therapies, and that's something that can only be gotten here.
What I hear from patients as they call across the country is that they're not feeling that they're getting any extra kind of therapy, and what we do here is very cutting edge, very state-of-the-art, so that they are getting the activity-based restorative therapies. Our new patients start with a new patient evaluation by our physicians. We may offer up to 3, 4, 5 days a week of therapy. It's much more intensive than they've ever had before. It's usually about 3 hours of physical therapy and an hour of occupational therapy, depending on their level of injury.
The day treatment program is designed to identify, classify, treat, and individualize a lifelong in-home activity-based restoration program that can be accomplished in less than 6 hours per week and without any other caregivers other than those normally present. We track a series of neuroregenerative outcomes to evaluate the effectiveness of treatment. The program is integrated, multidisciplinary, physician-driven, and operated by certified therapists.
Because people are so dedicated and so well trained, and we have a very knowledgeable staff, and it's such a team environment that it is, in my opinion, the best place that you could possibly bring someone that has a spinal cord injury, just to maximize everything that you can do and to have people like us working for you.
The center offers hope to individuals with paralysis as it works to continue to advance promising therapies while helping people with paralysis achieve their personal goals of recovery.
What I want to tell patients about what they could get here at the International Center for Spinal Cord Injury, they get a therapist who's going to listen to them, who's going to identify the patient's goals and figure out how they're going to get there. No matter how big of a goal you come with, our therapists are going to figure out how we're going to point you in that direction and get you there incrementally.
Hope is an element that contributes to getting better. If you take away hope, you're definitely going to impair the process.
As a living example of what functional restorational therapy can do for an individual with paralysis, I truly believe that if you focus, stay committed, and be determined, and do the FES bike, do the standing frame, do all of these modalities that are so crucial in keeping yourself fit that your outcomes will definitely be maximized.
You come here for a day and you realize how much fun you're going to have throughout rehab. They push you. They do it in every way that you think can't be possible. Even on a Tuesday when there's dead to the world outside, or when you come here and put a smile on your face and you realize that these people are here working with you and you're taking another step closer to what they said couldn't be done.
My ultimate goal, and the ultimate goal of our center, is to help everyone living with paralysis and give them a better life today. And that's something that we can do simultaneously while we're working on developing curative treatments for these individuals.